Hi, everyone. Welcome back to another episode of Ask Dr. Ted. This is Friday, February the 10th, 2023. And once again, welcome back. I thought this would be an interesting topic. We have the Super Bowl coming up in 2 days. And what does everybody think about or hear about when we watch football? There's a lot of heads bashing into each other. And so the topic of concussion, I was thinking about that. It's one of those really interesting topics we always hear about. Nobody really knows what it is. And every time I work in urgent care or in the ER, I am not kidding you, virtually every shift, some kid comes in because from, 2-year-olds are usually standing in the grocery cart and then mom's, looking at the groceries and just kind of pulls it and the kid, takes the feet out from under the kid and they flip and fall and they always land right on their head and they're, 18 months to 3 years old. And of course they hit the ground and they've got this ugly, horrible goose egg wherever their head hits. And it's purple, it looks horrible, and the kid's screaming, and they're thinking, oh my gosh, they're going to die, don't let them go to sleep, or whatever. And all the way up to high school, playing, sports, or young girls too, playing volleyball, basketball, kids are always playing, tricky bars, jungle gyms, that kind of thing, kids fall. We just here in Utah had a tragic story on the news about a little child that was playing on the playground equipment, and on top of one of the slides fell off and hit, must have hit their head or something. They don't have the answers to us yet, but the child died, a little grade school kid. So these are very common things, but why are they so worrisome? So first of all, let's discuss what concussions are and why they can be worrisome. So first of all, let's just say, I just thought rather than show you pictures, that's a little awkward. Let's say this is your brain and this is your spinal cord. This is a big spinal cord. Normally it's like your brain here and your spinal cord would be this thin little thing running down from the brain. But just for discussion's sake, here's your brain, here's your spinal cord, right? So as the spine goes down, the nerves peel off and go down your arms from your neck. And then when you get to the down lower near your legs, it peels off and nerves go down to your legs. And the part of your brain, the reason we worry about concussions is because the part of your brain right here at the base, or the primitive part of your brain, is called the medulla. The medulla oblongata, there's a fancy word for you. The medulla, the base of the brain, is where your breathing center is, okay? Now, when a kid hits its head, from whatever reason, falling out of a grocery cart or two kids running and falling. One time I was running as fast as I could, 5 years old, and I tripped and fell and hit my head right on a cement wall. And man, I had a goose egg about the color of this shirt that I'm wearing. And scared my mom to death. And I remember the whole thing. I screamed, and I had really a big goose egg, and it was purple, blue and purple, and it went fine, got better, fine, everything's fine. But when do you need to worry? So the reason I was telling you about the base of the brain, we'll come back to that. What a concussion is, the word concussion is just a regular word in the English language. It means a hit, right? To concuss something is to hit something. Like when a bomb blows up, you get the concussion wave, which is just all the air molecules being pushed so quickly away that the blast force of all those air molecules hitting you can knock people right off their feet. And that's a concussive force. It doesn't have to be something hard that you landed on. But thank heavens, bombs are unusual, and that's very unusual, but you fall and hit the ground all the time. Or you bump up. I had a patient one time that was 90 years old that stood up real hard and hit her head on the cupboard. And this is a true story. This was about 7 or 8 years ago. I was working in rural Minnesota. And this 90-year-old lady, and she was on a blood thinner. A lot of 90-year-olds are on blood thinners for various reasons. She stood up, hit her head real hard. And they thought, oh my word, she hit so hard, didn't knock her out or anything, but they thought, we better take her to the hospital. So they did. They got a CAT scan of her brain where they can take images of your brain in different, from like millimeters to centimeters and just make sure that there's no bleeding on the inside. Because what happens when you hit your head, we're not worried about the goose egg that goes out because your skin can stretch, right? If you get a goose egg and it's pushing the skin out, that's not going to do anything scary damage to you. But what's scary is when you get bleeding on the inside. Your brain is encased in a bony skull, and bones don't stretch. And so when you hit your head really hard, if you get bleeding on the inside of your head, that brain wants to swell. There's just some reason why brains, when you hit them hard, they swell. So what happens is when you hit your brain really hard, and here's what happens in an older patient. As you grow, your brain, let's say here's your brain gets bigger and bigger and bigger and grows. And the skull grows in response to the brain. So if you have a disease or a condition, and I think they're rare, but you have a condition where your brain doesn't grow, your skull won't grow. And so you have a little brain and a little skull, and they usually have learning disabilities, and you can spot them from a long ways away. They're just, something's not right. Their personalities and different things, they don't function normally because their brain never grew, and therefore their skull never grew. And as you get older, this normal 90-year-old lady hit her head, and as you get older, the brain can atrophy a little bit, but the skull doesn't shrink. And so what can happen if you fall, your brain gets bumped around in there, and there's some blood vessels in there that connect the inside of the skull to your brain, and those bridging veins that connect the skull and the brain can tear. And it may not be, it's probably not going to be an artery bleed, it's going to be a vein bleed. And they may just drip, drip, drip. 1 drop an hour. Well, over days or weeks, that can add up. So this lady stood up and hit her head. They thought, we better take grandma in. She's 90. She's on a blood thinner. They did a CAT scan. Everything was fine. Took her home. That wasn't me. 2 weeks later, I came in, and I was working the same ER, and they brought grandma back. And I said, well, so what happened? Is she acting weird? Well, no, she's walking, talking. Everything's fine. But when we got talking about it, she thinks Nixon is the president. And this was like 2013, 2014. Obama was the president. And I said, are you serious? And saw you walk over. I said, who are you? She gave her correct name. What day is it? She knew the date, the time of season, knew all of her family, could talk normally. She had a sense of humor. And I'd say, I mean, these are all higher functioning, right? Sense of humor and cognitive functions. So I said, who's the president? And she goes, Nixon. Why does everybody keep asking me this? Nixon. And I said, do you know who Obama is? Yeah. Well, who's the president? Nixon. She thought we were crazy. So, of course, something's odd. So we got a CAT scan, and I'm not kidding you. The inside of her skull, she had a, let's say we're taking a CAT scan like this, and we're going to take my head and tilt it like, so you're looking down on the brain. From the front of her head to the back, she had a bleed in there that was like 1 inch thick. And it started, here's your skull. And so the brain was getting moved over from all this blood. It was pushing her head this direction. And over 2 weeks, your brain can acclimate, and it can do it slowly. If we hadn't caught it, eventually it would have, you can't live like that. That would have eventually, what can happen, that's why we're going back to the medulla, where your breathing center is. If the brain swells too much, and it can't swell because of the skull, what does it do? It wants to go down the same hole your spinal cord's going in. And when it starts to push down on the spinal cord, you can't breathe. That's what doctors worry about, and nurses and everybody else. When you got a concussion, we're worried about the bleeding on the inside because your brain can't swell very much before you start having problems. And so a concussion, that's what we worry about. That's why doctors hate them, nurses hate them. It's not the goose egg that can expand. There's plenty of room for your skin to stretch. It's the bleeding on the inside that goes in and pushes your brain down, and that can be fatal, right? Or it can just cause seizures or everything else. Brains don't like blood next door to them, or you can bleed into your brain as well. There's several different kinds of blood in your brain you can bleed from hitting your head, but the blood between your brain and the skull is probably the most common. So what is a concussion? A concussion, like we were saying earlier, is some kind of a compressive force or a hit. You hit your head hard on something. That's a concussion. So as far as the definition of concussion, a medical concussion is what we're worried about. That's what you're taking your child in for, or your teenager, or you. When you hit your head really hard, that's just the definition. You got a concussion hitting your head. But the medical concussion is a change in mental status because of that hit to the head. So let's say there's 3 levels. Basically, there's a mild concussion, moderate concussion, severe concussion. A mild concussion would be like 2 football players hitting so hard that one of them kind of is acting a little dazed, and he's staggering around, and he goes to the wrong huddle. And the other team's going, hey, he's cheating. No, he's not cheating. He doesn't know where he is. People, you can go up to him and say, what's your name? And he just looks at you like, he doesn't know what you're saying. He's kind of there, but not there, right? The lights are on, but nobody's home, right? He got his bell rung. A lot of people say in football, he got his bell rung. He's awake. He's looking around, but he's not alert. He doesn't know what day it is, what his name is. He doesn't know he's playing football. He's wandering around. That's a mild concussion. He didn't get knocked out, but he did have a change in mental status. Normally, he's awake, looking around. He knows exactly all those questions, but suddenly he doesn't know those questions. That's a change in mental status. A minor change because he didn't get knocked out, but it's a mild concussion, okay? A moderate concussion is he did get knocked out, but for under a certain amount of time. And I'm not going to go to all the definitions. You can Google them and look them up. He did get knocked out, but under a certain amount of time. A severe concussion is he or she hit their head, a child, an adult, a teenager, hit their head, and they did get knocked out above a certain amount of time. And the big question is, how do we check to see if they're bleeding inside their head? So here's the key. Anybody that has a change in mental status, they ought to be seen. That's my opinion. I don't care if they weren't knocked out. They ought to be seen because the doctor's going to look in their eyes. You know, doctor comes in and shines the light in their eyes. That's one thing you do. We're looking for the pupil, but there's other things we're looking. If they really know what they're doing, they shine an ophthalmoscope and look at the back of your eyes and see if there's any changes back there. They'll also look in your ears to see if there's any blood behind your eardrum. They'll look to see if there's any bruising around your eyes or behind your ears. If there's any fluid, clear fluid, especially cerebrospinal fluid. When you do a spinal tap, you get that fluid. Your brain kind of floats inside your skull. There's this clear fluid. It looks like water, and your brain kind of floats in there. And if you break something, clear spinal fluid can run out of your nose or run out of your ears. Almost surely they would have a severe knocked out concussion if that was the case. Those are rare, thank heavens. And that's maybe the best thing I can tell you is thank heavens, most kids that hit their head real hard, like 99.9% are nothing worrisome, but you still need somebody to look and see because everything important is right here. And you just want to know for sure. If they hit their head and they cried immediately and they're acting normal and they know you're their mom and they know you're their dad or they know their friends and they know what day it is, what time it is, they're fine, but they got a big goose egg. And other than that, they're fine. You don't really need to go in. If they had any change in mental status, like they're dazed for a minute, they don't know where they are or who you are. Certainly if they get knocked out, who cares how long? Moderate concussion, knocked out for a little while, or severe concussion, knocked out for an extreme amount of time. Anybody that gets a hit to the head and they are a little change in mental status, I would take them in and be seen, right? The ones that get knocked out, obviously, because they may scan them, they may not. If they get knocked out, they'll get scanned, I promise you. Somebody gets knocked out, they're going to want to do a CAT scan and see if there's any bleeding in there. And you can see it. It shows up. Sometimes like this older patient of mine, it might drip, drip, drip for 2 weeks, but the brain can accommodate that to a degree. And so we found it. And I ended up calling the bigger hospital. I'm out in rural America and way up in Minnesota. So I called the biggest hospital and called the neurosurgeon. And I said, hey, we've got this lady, 90 years old, and she's got an inch thick subdural hemorrhage under her scalp. And he says, well, how does she, I said, what does the family want to do? You know, she's 90. Sometimes you don't want to do anything. The treatment could be worse than the disease. She may not survive the procedure to get that blood out. I said, she's young, 90. She lives alone. She shops, does all her finances. The family said, no, she does everything by herself. So we sent her to the big hospital, and the neurosurgeon went in there and they do a procedure and get that blood out, and she did fine, believe it or not. So any change in mental status, they're acting weird, bruising around their eyes, bruising behind their ears, fluid leaking out of their nose or their ears, you go in and be seen. If they hit their head and they feel fine, but they got a big goose egg, we don't worry about goose eggs. I mean, if they cut themselves, they need stitches, obviously. But a goose egg, you don't die from a goose egg. You die from what's going on the inside. And if something's going on the inside, you'll know. They're acting weird, or they can't move a hand or an arm or something weird. Something will be wrong. Their vision's changed. They're speaking weird, besides those physical exam things. Here's one other thing. When you hit your head really hard, it's very, very common to get nauseated. I've seen, I can't tell you how many hundreds of people in urgent care or the ER, or they went to the ER and they're seeing me a couple days later in my office. They hit their head real hard. They got severe nausea, but they didn't throw up. Don't worry. That's okay. It's normal to get nauseated. If a kid gets nauseated, or an adult, and throws up once, we don't worry too much about that. If everything else is fine, they're totally awake and alert, and they didn't have any dazed period or loss of consciousness. Nausea is common. They threw up once. We're not worried. The second time, start getting a little iffy. It depends. We'll start asking some other questions, and I still want to see them and see what they look like. If they throw up 3 times, like retch, 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 and then 10, 15, 30 minutes, retch, retch, retch again, they throw up again. If an adult does that, I'm scanning them, right? I'm getting a CAT scan. If a kid does it twice, we'll probably say, let's keep an eye on them, watch them. If they do it 3 times, they get scanned. So if your kid hits their head and they get nauseated, not a worry. If they throw up once or twice, not too worrisome. If they're acting normal and they're crying and they never got knocked out, and they never acted weird, you're fine, even with vomiting twice. But the third time, you know, and again, they probably work with your doctor. It's a case by case, and I'm not going to be there to tell you, but if they're just crying and they throw up once, even twice, but they're fine every other thing, no bruising, no fluid leaking, you're fine. Just watch them. Parents always say, can they go to sleep? Yes, they can go to sleep. Change the mental status? No. Take them in and be seen. And then you know they can go to sleep if everything's fine. Why don't we just scan everybody? They've done many, many studies because kids are always hitting their heads. And so there's tons of patients to study, especially in the pediatric hospitals, because kids fall more than anybody, and old people too, because, you know, as you get older, you're not as steady, and they're on blood thinners, older people. So there's lots of studies on this. But so why don't we just scan everybody? Because CAT scans are a lot of radiation. One CAT scan of your head is like 200 or maybe even more, 200 x-rays of your chest. Well, that's a lot of radiation. If you need to do it, you need to do it. It's okay. It's not going to, you know, it's not going to hurt you to do one. And sometimes you have to just do that. I've had 2 or 3 CAT scans over my lifetime, and I'm not worried. But your thyroid lives right next door to your brain, and your thyroid is sensitive to radiation. Thyroids don't like radiation. They can develop a cancer. And they've kind of estimating now, I think it's for every 1,500 CAT scans we do, we may actually be causing 1 case of cancer, thyroid or whatever others. So we don't just scan everybody if you don't need it. And so if you have any questions, if you're not sure, just take them in. Go to an urgent care, have them look at them. If they get dazed or their bell rung, or certainly if they get knocked out, you go in, right? You don't need me to tell you that. But kids hit their heads and they scream and cry and everybody's really worried and they never throw up, you don't need to go in. If they don't throw up and they're never lost consciousness or never acted weird, you don't need to go in. But if they act weird or they throw up twice or more, or if you're just worried, just go in and be seen. Okay? So now you can watch the Super Bowl. And if somebody, you know, gets hit real hard and they're wandering around the field, you're like, oh, he's got a concussion, a mild one, because he's still walking around. He's not unconscious, but he doesn't know where he is. He doesn't remember he's in the Super Bowl. That's a mild concussion. If he gets hit and knocked out, oh, he's got a moderate or a severe concussion. It depends how long he's unconscious as to moderate or severe, and they're going to scan him, I guarantee you. Every time, remember Steve Young had like 7 concussions and he finally had to retire. Every time you get knocked out on the field, you're unconscious. Steve Young had a concussion, was knocked out on the field. Every time that happens, you're knocked out, they get a CAT scan. And when you're making millions of dollars a year, maybe they scan everybody anyway, even if you're acting weird, which they should if you're acting weird. Anyway, hopefully that answers some questions. And next one I'm going to do is 5 ways that your child could accidentally die in your home. I'm not going to say you can kill your cat because parents already feel guilty. So 5 ways your kids can accidentally die at home. You will not believe the things I'm going to show you. You could have on your floor at home right now. You wouldn't even know it. If somebody teaches you, you're like, oh my word, I didn't realize that could be deadly if your kid swallows it. Very interesting, good information to know. Some things in your carport, garage, some in your house. Be interesting. Hopefully it'll be interesting and maybe even help somebody help with their family. Okay. Thank you so much for tuning in, and we'll see you next time. Bye-bye.